Next, we have speakers from YouthCO. YouthCO exists to reduce the impact that HIV and Hep C have on youth of British Columbia. They are an organization of young leaders who work to affect meaningful change through peer support, education, and community engagement. Joining us from YouthCO are Sarah Chown and Amber Bedard.
Hello, my name is Amber, and this is Sarah, and we work for an organization called YouthCO. YouthCO is a youth-led HIV and hepatitis C organization that provides peer programming, whether it is through support or education to reduce the stigma relating to HIV, AIDS, and hepatitis C. Through this peer-driven approach, YouthCO is fostering inclusive communities where youth empower youth to make informed decisions about our own well-being when it comes to sex and substance abuse. I work with YouthCO's Yosnoas Aboriginal Youth Program, which is an HIV and sexual health program created by and for Indigenous youth. Our program takes a culturally responsive and sex-positive approach to discussing healthy sexuality with other Indigenous youth. We believe that taking care of our bodies is an integral piece in healing and decolonizing. Visit our table at the back to learn more, especially about our other programs that involve HIV with young gay, bisexual, two-spirit, queer men, and other workshops. Being a health organization, it's important that we talk about Pharmacare and why it matters to us as youth. We see Pharmacare as one of the supports that we need, and we believe HIV and Hep C treatment and pre-exposure prophylaxis for HIV prevention are crucial tools for reducing the impact of these viruses in our communities. Pan-Canadian Pharmacare should mean that all youth in Canada are able to access medications as a part of our care when it comes to HIV treatment and prevention, treating hepatitis C, and supporting our overall wellness.
So, as we've heard, in Canada, we have a system called Medicare, and there's lots of things about it that are broken. It was introduced in the 50s with the idea that Pharmacare would come soon after, and 65 years later, that has yet to happen. Currently, many health organizations gathered here and elsewhere in the country are working to advocate for Pharmacare to be on the priority list. Currently, access to and cost of medications varies significantly depending on where we live, whether that's on or off reserve or what province we're in and our citizenship status. In the case of HIV treatment, some provinces provide medications free of cost to everyone living with HIV regardless of status, whereas in other provinces, we have to be a certain level of sick or a certain level of poor in order to qualify for treatment. And sometimes we have to put a percentage of our income towards covering these costs. In terms of access to HIV treatment, BC is a really good place to be in Canada. Our province has made HIV medications available and has significantly expanded access to Hep C treatment. However, we believe that this level of access to medication is a necessity, not a luxury to be handed out based on the luck of where you live or where you were born. We also know Pharmacare matters for youth living with health conditions beyond HIV, from diabetes to depression. At this time, 3 million Canadians cannot afford to fill the prescriptions that have been written by our doctors. Pharmacare was first proposed as a Canadian policy in approximately 1964, depending on who you talk to. Since then, various policy proposals have been put forward to ensure Canadians can have better access to medication. And so we have a piecemeal system, and there's no overarching Pharmacare program. Not all federal parties have released their position on Pharmacare at this time. However, I can tell you that both the Green Party and the NDP Party have talked about Pharmacare as part of their campaign promises. This election, it's time to make Pharmacare a reality.
In BC, Indigenous people make up 4% of the population, but 12% of new HIV diagnoses. These inequities are also seen across Canada. Indigenous people continue to be disproportionately represented in the HIV epidemic. Having access to healthcare and education services that are relevant to our populations are key ways that we can reduce the impact of HIV and hepatitis C within our youth. As we heard from Jessica, being an Aboriginal youth, we face challenges unique to a colonized people, and that this can interfere with the quality of healthcare we receive and our ability to access treatment or medication. We may face displacement, for many of us don't live in our home communities. Colonization can wear the guise of many things, like moving away from our home communities, whether that be to receive an education or get a job, or due to bureaucratic agencies removing us from our homes forcefully or without our consent. Through all of this, we are looking for communities that will support us. Interprovincial migration, which is simply a fancy term for moving from one province to another, is another factor that might influence our ability to partake in the health and pharmaceutical coverage available to us. On or off reserve, whatever province we live in, whether or not we have status, we deserve quality, responsive healthcare and access to treatment. In addition, many of our people are disproportionately represented in the prisons, and through this, punished by the system with limited access to medication, treatment, and prevention for HIV and hepatitis C. This can be alleviated with Pharmacare. It's important to recognize and remember that we are a unique and self-determining people, and that we do have the power to influence how policy is being written.
So as Amber mentioned, those of us who are Canadian citizens, another legacy of the colonial system, do have the power to influence policy by voting in this federal election. The election is one way we can use our power, and at YouthCO, we're working to encourage each other to get our vote on. Whether we see Pharmacare as an issue of equity or an issue of economics, ensuring we can access the medications we need and that are prescribed by our healthcare providers means better health for Canada. We believe that wherever we live, whoever we are, medication matters, and Pharmacare is one way of getting that. We hope you will join us and get your vote on this election.